Whether it's a daily prescription or just a simple over-the-counter pill, most of us take some kind of medication. But let's be honest, how much do we really think about whether it's doing exactly what it's supposed to do? Today, we're diving into this whole idea of pharmaceutical care to figure out how we can all get the absolute most from our medicine. So let me just ask you this straight up. Is your medicine truly working for you? Think about the last thing you took. Are you 100% sure it was working as well as it possibly could? It seems like a pretty simple question, right? But the answer, well, it's often way more complex than you'd think. And that complexity is what leads us into what I like to call the medication maze. It's this tricky place where even if you have the quote-unquote right pill, things can still go wrong. Something can get in the way of you actually feeling better. See, for any medication to really work, it's about more than just the pill itself. Think of it like a chain with three critical links. First, you need the right indication, the correct medical reason for taking it. Then, you need the right drug product. And finally, you need the right dosage. If any one of those links breaks, the whole thing just falls apart. And there's actually a name for this. In the healthcare world, they call it a drug therapy problem. It's basically a formal way of saying that something, anything in your medication plan is stopping you from getting the results you want. And you know what? Spotting these problems is the very first step to actually fixing them. Okay, so how do we fix them? How do we navigate this maze? Well, it requires a pretty big shift in how we think about medicine. We're moving toward a totally new approach to care, one that puts the focus where it should have been all along. Here's the difference in a nutshell. The old way was all about the product. The main question was, did the pharmacy give you the right pill in the right bottle? But the new way, it's all about you, the patient. The real question now is, are you getting the best possible health outcome? I mean, that's a huge difference in perspective. And this new philosophy, it has a name, pharmaceutical care. And its definition is, well, it's everything. It's about using drug therapy to achieve outcomes that, and this is the most important part, improve or maintain a patient's quality of life. It's not just about fighting a disease, it's about making your life better. So to make that happen, practitioners use a really simple but super powerful framework. I want you to think of it like 4 pillars holding up any successful treatment plan. These are the absolute essential questions we should be asking about every single medication we take. Yep, that's it. Just 4. Think of it as your own personal checklist for your health. So let's walk through them one by one. Okay, pillar number 1 is appropriateness. This is the big one, the most fundamental question of all. Do you actually need this drug? Is there a clear, valid medical reason for it? It's all about the why behind the prescription. Now, when this pillar gets a little shaky, 2 big problems can pop up. You might be getting unnecessary drug therapy, basically taking something you don't really need. Or, on the flip side, you might need an additional drug, maybe for prevention, and you're not getting it. All right, next up, pillar number 2, effectiveness. So we've decided a medication is needed, but is it the most effective one out there for you? And is the dose hitting that perfect sweet spot, strong enough to get the job done, but not too strong? The problems here are pretty straightforward. The drug just might not be the best one for your particular condition, or maybe it's the right drug, but the dosage is just too low to make a real difference. Either way, it's not really working. Pillar 3 is all about safety. Look, a drug can be appropriate, it can be effective, but if it's causing you harm, that's a massive problem. So this pillar asks a simple question. Is this medication causing any bad side effects or any signs of toxicity? And the risks here are pretty clear. You could have an adverse drug reaction, which is really just any unwanted effect. Or the dosage could be too high, which can lead to toxicity. The whole goal is to heal, not to harm, right? This pillar makes sure we stay on the right side of that line. And that brings us to our 4th and final pillar, compliance. Now, this one is super interesting because it focuses entirely on you, the patient. It asks, are you willing? And just as important, are you able to take this medicine exactly as prescribed? And listen, this is so important. Non-compliance sounds like someone is just choosing not to follow orders, but it's rarely that simple. It's about real-world stuff. Maybe the instructions are confusing. Maybe the medicine is too expensive. Or hey, maybe life is just busy and you forget sometimes. All of these are real barriers that need to be talked about. So with those 4 pillars in mind, how do pharmacists and doctors actually put all this into practice? Well, they have a system, a kind of playbook for making sure you're getting the best possible care. This system is called the pharmaceutical care cycle.
And the most important word there is cycle. See, this isn't a one-and-done conversation. It's a continuous loop, an ongoing process of checking in, making adjustments, and always trying to get things just right for you. So, what does this loop look like? It starts with assessment. That's where they use those 4 pillars to figure out your needs and find any problems. From there, they develop a personalized care plan. Next up, they implement that plan. And then, and this is so critical, they monitor the results. Is it working? If not, the cycle just starts all over again with a new assessment. All of this leads to what I think is the single most important idea in this entire explainer. This new approach to care completely changes your role in your own health. It's a huge shift from being a passive patient to being an active partner.
I mean, just look at this comparison. The old way was all about compliance. The word itself just kind of implies submission, right? The doctor had all the authority and you just followed orders. But the new way is about concordance. And that's all about agreement. It's a real partnership. Let that sink in for a second. In a concordant relationship, you are an equal partner in making decisions about your own health. It means your experiences, your concerns, your goals, they all carry just as much weight as the clinical data. Your voice matters. So I'll just leave you with this question. The next time you sit down with your doctor or pharmacist to talk about your medication, are you going to see yourself as just a patient, or are you going to see yourself as their partner? Because honestly, that simple change in perspective, it could change everything.